This is a public awareness program organized at St. John's Medical College Hospital at Brigade Meadows as part of Infection Control Week. Following strict infection control practices helps us in reducing the healthcare costs along with the ICU length of stay of the patients. In our ICU, we have at the entrance itself and also at every bed space, we have hand rubs, and our staff are trained to use those hand rubs before and after touching the patients.
We in emergency department at St. John's Medical College Hospital at Brigade Meadows follow a strict hand hygiene protocols. As in emergency department, the hand hygiene compliance is very difficult as we have to look at many high risk procedures. Very fast decontamination with a regular hand rub or a meticulous hand washing with soap and water. So these, we ensure that all these protocols are strictly adhered to, and with it we can prevent the cross contamination of diseases and we becoming vectors. And also we strictly follow all hand hygiene practices before going to the patient or after touching the patient. We ensure hand rubs are all the time placed at every bed and also at the entrance of the department, so it is easily utilized by everyone in the department as well as coming to the patients. We also ensure that all the patients who are coming to the hospital are safely going back home, as your safety is our priority.
Today, we join the global community in celebrating World Hand Hygiene Day. In our clinical setting, our hands are the most important tools, but without proper care, they can be also be the primary vehicle for the transmission of infection. To ensure the highest standard of safety to our patients and for ourselves, let us reaffirm our commitment to the 5 moments of hand hygiene. Before touching a patient, before clean or aseptic procedures, after body fluid exposure risk, after touching a patient, after touching patient surroundings.
Behind every successful orthopedic surgery is a simple habit: proper hand hygiene. From fracture care to joint replacement, clean hands prevent dangerous infections, protect implants, and improve patient recovery. A few seconds of hand cleaning can prevent weeks of complications. In healthcare, clean hands truly saves lives.
I not just treat my patients with just prescriptions, but I also treat my patients by making sure that prevention is remembered as better than cure. That is, by making sure again that infections do not spread. Just 30 seconds of using a hand rub can actually prevent a lot of infections. So this Infections Day, let's remember, make sure that we use a hand rub for at least 30 seconds to prevent infections.
Hello. As a physician, I often tell my patients that the most powerful tool which we have to preserve our health is not complex prescriptions. It's actually our hands. As we age, our immune response goes down. So that makes our hand hygiene much more important. There are some gold standard rules which I ask my patients to follow. One is 20-second rule, that is wash your hands for 20 seconds. And for senior citizens, most importantly, wash their hands once they are back from the public places. And whenever you cannot wash your hands, use a 60% alcohol based sanitizer to maintain hand hygiene, and also not to forget to moisturize their hands to prevent development of cracks in the skin. So when we say your health is in your hands, we literally mean it. So protecting or maintaining hand hygiene is the best way to maintain your independence.
As an anesthesiologist, my hands are constantly in motion, adjusting flows, administering medication. Managing airways, we often focus on the sterile field of the incision, but the anesthesia zone is just as critical. Contamination of the IV port is just as dangerous as the slip of scalpel. Let's recommit to the WHO 5 movement, especially before touching a patient and after touching their surroundings. Clean hands are the simplest and most effective tool. We have to ensure that our patients wake up and they leave the hospital healthier than they arrived. Today is World's Hand Hygiene Day. Happy Hands Hygiene Day.
Hello everyone. So today I want to talk about the most important instrument in our trade. It is in the drill, the oscillating saw or the robotic arm. It is our hands. The stakes, biofilm and hardware. In other specialties, an infection is a complication. In orthopedics, an infection is a catastrophe. When we place a prosthetic joint or fixation plate, we are providing a sanctuary for bacteria. Once a biofilm forms on the metal, our antibodies lose their reach and our patients face months of debridement, hardware removal and lose mobility. So hand hygiene is not just a regulatory checkbox. It is the first and foremost critical step in protecting the integrity of implants we place and the lives of the people who trust us. Thank you.
Good morning all. I am Dr. Preeti Puranik, Senior Consultant Pediatrics in St. John's Hospital, Brigade Meadows. In pediatrics, we often deal with complex cases, but our strongest defense is incredibly simple. To keep it brief, I leave you with 3 essential points. First, the 20-second rule. It takes less than half a minute to break the chain of infection. Whether using soap and water or an alcohol-based rub, hand washing is what saves lives. The first step protocol. Hand hygiene should be the very first interaction a patient sees. It builds immediate clinical trust with parents and ensures a safe zone for the child. Third, protection beyond clinic. By practicing ourselves, we model a habit that our children take home, reducing the community spread of many illnesses. So, the bottom line is, clean hands are the simplest gift we give our patients. Let's make safety a reflex and not a chore. Thank you.
The importance of hand hygiene in the life of a doctor, in the life of healthcare professionals, it cannot be overemphasized. We are touching patients, we are taking care of them, and they are trusting us. So, it's very important. And that is the most neglected thing among us. How many times do we wash hands? So, I think all of us have to think about it as to whether I am washing my hands after seeing each patient in my OP. Of course, I'll scrub, like I'll take 1 to 2 minutes and scrub before I get into the OT for a procedure. But do I do that? Do the same thing in the OP after every patient and before seeing every patient? So let's take a step back and contemplate whether we are doing that on a daily basis. Thank you.
Hand hygiene plays a crucial role in preventing infections in ENT practice. Proper hand washing reduces the spread of bacteria and viruses that can cause conditions like sinusitis, tonsillitis, and ear infections. Healthcare workers must clean their hands before and after examining each patient. Using sanitizers also protects both patients and doctors from cross-contamination. Good hand hygiene is a simple yet powerful step in ensuring safe and effective ENT care.
Okay, from ophthalmology department, it is needless to say that a proper hand hygiene is essential to prevent the spread of eye infections and also to protect the vision. Before and after every patient examination, clean hands reduce the risk of contamination and reduce the risk of transmitting microorganisms. Simple measures like washing hands with soap or using sanitizer can make significant difference in patient safety. Please remain committed to strict hand hygiene practices for better eye care and overall health. Thank you.
According to the WHO, healthcare-associated infections affect hundreds of patients globally each year. At any given time, about 7 out of every 100 hospitalized patients in high-income countries and up to 15 out of 100 in low and middle-income countries will acquire at least one HAI. Various studies have shown that 50 to 70% of these infections are preventable. But how? It's only with hand hygiene. At St. John's Medical College, Brigade Meadows, we adhere to strict hand hygiene and infection prevention protocols at all times to ensure patient safety. Beyond hand hygiene, we follow a rigorous sterilization procedures for medical devices and instruments, along with comprehensive environmental cleaning protocols. Our healthcare teams are well trained and continuously monitored to ensure safe delivery practices and adherence to established standards. We at St. John's Medical College, Brigade Meadows also place strong emphasis on patient education. Our patients are guided on the importance of infection prevention measures both during their hospital stay and after discharge, including proper hand hygiene practices and other essential precautions to reduce the risk of infection. Thank you.
So greetings to all of you in the occasion of this infection control and prevention week that we were celebrating. Of course, in every hospital setting, as we know, prevention and control of infection is one of the major challenges in any healthcare setting the healthcare workers face. And in St. John's, of course, we follow the standard precautions, starting with hand hygiene and the other techniques, infection prevention protocol that we have strictly followed and being followed in our hospital. And this week we celebrated mostly to make our own healthcare workers aware of the importance of hand hygiene and the prevention of infection. And for that, number of activities, number of awareness, and mostly, of course, training and retraining becomes a major part in our infection control and prevention. So that's what we are celebrating in this week, and thanks to everyone who have joined hands to make this event successful. Thank you. Action saves lives.